Has your sunshine been taken away by melanoma?
Are you tired of taking all the precautions to protect your skin before stepping out into the sun? Or do you suffer from Erdheim-Chester disease? We might be the answer. Zelboraf is an FDA-approved form of targeted therapy that combats both ECD and late-stage melanoma. Delocalized and specific, targeted therapy can be tailored to patients with different forms of cancer, and Zelboraf works to combat melanoma caused by a mutation in a specific protein pathway. Check with your doctor to make sure that you have this mutation before beginning Zelboraf, as it is present in 60% of melanoma patients. Zelboraf is an oral tablet prescribed to take twice a day, 12 hours apart. Once metastatic melanoma reaches the lymph nodes, the average survival rate is only 63%. This number drops to 20% when the disease metastasizes to other organs. When taking Zelboraf, however, patients have an astounding 84% chance of survival. Before taking Zelboraf, tell your doctor about medications or supplements you are taking, as they may interfere with the effects of Zelboraf. Also, let your doctor know about any liver, heart, or kidney complications, as well as any intended surgery or radiation treatments. While taking Zelboraf, avoid sun exposure, pregnancy, and breastfeeding. Zelboraf may cause symptoms. Contact your doctor if you experience any of the following after taking Zelboraf: tiredness, joint, muscle, arm, leg, or back pain, redness or swelling in hands, feet, ankles, or lower legs, change in sense of taste, headache, hair loss, dry or itchy skin, diarrhea, constipation, cough, changes in skin appearance, new wart, skin sore or red bump that bleeds or does not heal, change in size or color of a mole, fatigue, unusual bruising or bleeding, nausea and vomiting, loss of appetite, pain in the upper right part of your stomach, yellowing of the eyes or skin, eye sensitivity to light, eye redness or pain, vision changes, unusual thickening of palms or hands, tightening of the fingers inwards towards the palm, or unusual thickening of soles of feet.
Vemurafenib, or Zelboraf, is a targeted therapy aimed at inhibiting the oncogene BRAF protein. BRAF is a serine threonine protein kinase that has been implicated as a leading cause of melanoma. About 60% of melanomas have been found to be caused by an activation mutation in the BRAF gene on chromosome 7, specifically the BRAF V600E mutation, in which valine is replaced by glutamic acid on the 600 position of the BRAF protein. Our targeted therapy, Vemurafenib, inhibits oncogenic BRAF kinase by binding to the ATP binding sites, thereby interrupting the downstream biological pathway that had been altered to increase cell proliferation.
In normal cells, activation of the BRAF protein is regulated by extracellular growth factors, and the subsequent pathways serve to maintain expected cell division. In oncogenic BRAF, however, activation happens independently. In other words, it does not require any extracellular signals. This leads to the uncontrolled rates of cell division and proliferation observed in cancer. Vemurafenib works as a protein kinase inhibitor that binds selectively to oncogenic BRAF in order to block the activated pathway and prevent downstream signaling. This inhibition results in a downregulation of the MEK and ERK pathways, leading to a decrease in cell proliferation and survival. This can be an effective method to combat the hyperactivity of cancer cells.
Resistance to this therapy is possible due to the intratumor heterogeneity, which leads to the somatic selection of resistant cells. Tumor cells can evolve to produce excess PDGFRB protein that blocks apoptosis. The NRAS oncogene can be mutated to interact with BRAF and allow for cancer cell survival, or excess hepatocyte growth factor can cause mitosis and proliferation. Vemurafenib has been proven highly successful in clinical trials and for patients. With an 84% survival rate, Vemurafenib is an effective targeted therapy.